And now, this is Dr. Krieger's lecture program starring Dr. Krygier.
Now, the daily supplement protocol, we put this on at every lecture. This is the daily protocol that everybody should take. As you can see from our next slide, this is my new daughter. She was born April 4th. But this is what my wife took so we could have a healthy baby, 8 pounds, 4 ounces. It's very important to make sure that your nutritional adequacies are covered, and you'll see why tonight from the topic I'm going to be going over. Everything's healthy. We use Providence Birthing Center. It's the only birthing center in Michigan that has an alternative birthing center unit, and it seemed to work very well for us. They were very responsive. We didn't have a lot of medical intervention. We just basically had a natural birth process. So, yes?
You have 3 flaxseed oil there. 3 tablespoons, 3 capsules?
3 capsules.
3 grains?
3 capsules.
Okay.
So I definitely would recommend the Providence Birthing Center. They treated us very well there, and I mean, we just catered to. We had about 4 or 5 different nurses that were working directly with us, and my wife. This I put up probably 2 or 3 times before. We've all seen 60 years of hormone therapy has been used. There's been basically about 3 or 4 studies that have been done over the past 4 or 5 years that have told us that hormone therapy isn't as effective as we like to think it is. And I'm surprised that the research wasn't done earlier and the studies weren't done earlier, but we know how the pharmaceutical companies work. We know exactly what type of game that needs to go on before they come out with research. So we don't like to be experimented on as a public citizen, but unfortunately, that's why I'm here. That's why other alternative practitioners are out there to inform you and give you information that you can make a better choice. Here's the most recent article that came out just recently, April 24th, and it said it covered 20% more likely to have ovarian cancer and die from it from the therapy. So now we have ovarian cancer, now we have endometrial cancer, now we have breast cancer, okay? It's very simple. The process and the principle is very simple. When you have bad chemistry, when you're using a synthetic estrogen and your receptors are shaped like this, and you're not filling that exactly correctly, and that receptor is not correct, and it's maybe this form, you're going to cause side effects. It doesn't belong in the body. Your body's not going to recognize it. It's the same principle as the last 30 or 40 years for trans fats. Trans fats, they've known for the longest time that they raise your cholesterol and that biochemically they don't line up correctly in the right formation for your body to process that out correctly, and therefore you'll have high cholesterol eating out 2 to 3 times a week over a 3 to 4 week period. Your LDLs are going to go up and your HDLs are going to go down. They've known that for a long time, and they opportunized on that by putting out cholesterol-lowering medications. You know, they never told you to stop eating out and stop eating your margarines and your Fabios and your Parquets and all that stuff. They should have forewarned. I've never heard a patient come in and say, hey, my medical doctor told me, you know, to stay away from the synthetic butters or the fake butters. So, but that's important, and unfortunately, the research is coming out, and everybody's picking it up, and I'm going to keep on pushing it out there whether they like it or not, because your health's important and my health is important. I want to be treated. You know, just like you do, and that's how I present this information. I put this up. Michigan is the only state that you cannot sue a drug manufacturer if it's approved by the FDA. Okay, that's the only state, so they're immune. So that's pretty important because, you know, here's an example of the Vioxx painkiller. Here's, there's various examples, but Vioxx is the most obvious one for just, you know, this is a modified pain medication that can definitely give heart attacks and strokes and various other disease processes. So I don't usually get into this legal stuff, but I picked up a law paper and I started reading it. I said, God, I didn't know that Michigan was that lenient and that for drugs, you know. And then, spring 2007, Michigan Medical Law Report says now they're ending the immunity. They're trying to get laws passed to do away with this, which is obviously good. So I don't know if what I put up has made a difference, or basically people are getting the gist, and our lawmakers are figuring out that sometimes the benefits don't outweigh the risks. Now, I don't know about you, but since I have two daughters now, it's really surprising to me that we would make a law to even have a child get vaccinated even before they enter school. It's very strange to me, especially when the research is very new. I mean, as you're going to see, I'm going to go through a couple things, but Merck has came out with that new vaccine, Gardasil, that has to do with fighting against the herpes virus, which they want 3 injections before the age of 6th grade for your daughter to have before she can get into school, which has been just passed in Texas, which right now there's 30 states that are trying to implement that and go forward and get that into their program as a statewide vaccine initiative. I don't see how that's going to benefit. I think it benefits Merck's profits, obviously. There's basically 4 strains of the vaccine, or 4 strains of the herpes virus that it covers in the shot. I just want to go over a couple things on that. Their objective right now is to vaccinate 150 million girls. They want to take what's called a risk factor and vaccinate for a risk factor instead of a contagious factor. All the vaccines are based on contagious factors. Okay? So they want to take a risk factor and something that's not contagious in the general public unless there is some type of sexual contact or other initiatives. The HPV, there's about 100 different strains of the HPV. 30 of them are cancer causing. Most of them just cause warts and different variations. But the important issue is that HPV develops very slowly. It takes almost 10 or 15 years for the HPV to develop. And in most of the population right now, they figure 80 million people are infected with HPV. It's very high prevalence. And they're figuring right now, the CDC did a report, to quote them, they said that the 4 strains of the virus was only detected in 3.4% of the population when they studied it. That's a low statistic to have somebody be subject to something that's a risk factor. That would end up being probably about, cervical cancer would cause maybe 1 case in about maybe 3,500, if you really were to do the numbers. And that's not, I don't think that's substantial for other avenues that can prevent HPV, because they found that 23% of everybody that has HPV normally just goes into remission anyway from doing nothing. Okay? So it's a very shady subject. They also said that they also did a study with 20,000 young women. And basically, there was only 1,200 women or young girls under the age of 16 years old out of this 20,000 women, which is pretty surprising because they're pushing it in our daughters and in young girls, when that particular that age bracket is not even covered thoroughly. I mean, when you're doing 20,000, you want a defined age. So they're representing a low age bracket with very few people in this study. And then on top of that, they've only followed them from 18 months to 4 years. They're the least followed study, as well as the least number of subjects in the clinical group, but are being pushed the strongest, which doesn't make any sense. Even the European Medical Agency said that the efficacy and the immunogenicity, or how the immune system responds, requires close to monitoring of 10 to 15 years. At the most, they've been followed up for 18 years or 18 months, and the longest has been for 4 years. So you tell me what possibilities can come out of that, or how this can backlash if everybody lines up for a shot. We don't have enough information to go on. This comes to my next slide here. Telomerase is an enzyme. It's kind of like a protective coat over your DNA. We're made up of DNA. And those DNA, we have chromosomes, and those chromosomes are expressed in a map-like fashion to build an organ, build a blood vessel, build a neurotransmitter, build a protein, heal. All those genes are expressed. And every time those genes turn over, you have this protective covering, because you want to make sure that what's being manufactured correctly is being protected, because anything can happen instantaneously and cause a flaw. Okay? This telomere enzyme, if you kind of get repetition too much, you can actually wear out this enzyme. So what you want to do is you want to try to inhibit or stop or slow down this enzyme as long as you can, so you can protect the covering over your genes when they turn over or they change or you grow. Okay? And so what does this mean? This means telomerase, the more they turn over, 90% of all cancers have increased expression of telomerase, which is the enzyme, which is one reason why it has been suggested as a target for anti-cancer drug. In addition to telomerase, the telomeric DNA structure is being examined for its ability to be targeted by anti-cancer treatments. Now, where am I going with this? Basically, when I look through the research, and they want to use a vaccine for human papillomavirus, there's a component in green tea that can actually block the enzyme telomerase, so that the proliferation or the growth of the HPV can't go on. It can't go on. This is what this is saying. It says, basically, green tea, this long, here it is right here, epigallocatchin galat. EGCG is a major T, strongly and directly inhibits telomerase, which means it has been implicated in stopping tumor growth or genesis growth. Okay? Here's some of the other things. Hopefully we get this on a slide, because I don't understand most of these things, but basically it's blocking different cellular levels so that this growth cannot continue. HPV versus this green tea extract, they found that EGCG may be an effective therapeutic preventative agent in cervical cancer. So if you ever have a bad pap smear, or you're stage 1 or stage 2 or stage 3, there's nothing wrong with trying a product that we carry in the office to prevent something from further occurring. And green tea is the one that I will use, whether it's a 12-year-old or a 50-year-old female. That's what you use in a particular situation with HPV. Okay, this is the research. This is what they're saying. And this has been, this didn't get any headlines. The vaccine got the headlines. Here's the green tea extract. The green tea suppositories, there's only 21 in each, and it's usually a 21-day treatment protocol or a prevention protocol for the situation. So It's easy, it's effective, and there's a wide range of uses. Most people don't understand the implications of nutrition. And I know that because I see how many people walk in and want to take medications or are on a bunch of medications. So what I wanted to do was use this lecture to explain how nutrition affects your body and what particular enzymes your body is affected by when you take this dose, or this dose, so you'll understand in our office why, hey, you only need to take 4, or hey, you need to take 10, or hey, you need to take 15, okay? People don't understand, they're like, how come I got to take so many pills? This is why you got to take so many pills, because everybody's different and everybody's at a different level, okay? It's my job and it's Dr. Tent's job to focus in on what particular condition or nutritional problem you have, and then doses as we see fit. But this is why we would dose something a little higher or a little less. Let's go through this. It says high-dose vitamin therapy stimulates variant enzymes and decreases binding affinity. Okay, basically what this is saying is that for somebody it might take a little bit of vitamin to turn over an enzyme to cause a neurotransmitter to be developed to affect a nerve or a thought or a behavior or something. Now, in some people, what happens is you might need this much of the enzyme to turn over that enzyme, okay? So that what this is saying is these therapies stimulate variant enzymes. Enzymes are what you are taking your vitamins for because enzymes are cofactors. And in order for you to get an enzyme to work correctly or the signal to be sent in the right direction for the right purpose, this enzyme has to be pushed. If it's not pushed, nothing will happen. Okay? So what happens is this means that some people genetically have a low binding affinity or a low binding threshold to certain nutrients, and they're calling this genetic problems. Okay, so they're saying, well, we can't really fix this. This is genetic. There's 2 types of genetics that you got to kind of put in the back of your mind. You got the genetics that you're born with. Okay, that's called a genotype, a type of gene that you're born with, and then you got your phenotype. Phenotype is you interacting with your environment and how you are exposed to something or you do something, and that causes the expression of that gene to come out. So you have control over your phenotype, and sometimes you have control over your genotype, which are your genes that you were born with. Okay? So literally, what we gotta know and understand is that in the gene process, most of the time, you have control over your body. You can express certain things so that you can have an outcome. And that's the research that it's talking about. It says right here, it says in the American Journal of Clinical Nutrition, it shows about 50 human genetic diseases due to defective enzymes can be remediated or ameliorated by administration of high doses of vitamins. Component of corresponding coenzyme, which partially restores the enzymatic activity. So if you have a problem and you need to turn up that enzyme to turn that enzyme over, that genetic problem could become a fixable problem now. Therapeutic doses can also be applied to, we're going to go over this, polymorphism, association with disease risk for which molecular evidence suggests that a mutation affects a coenzyme binding site. So if you affect that binding site, you're not going to get that enzyme to push and make an artery or make a vessel or make a neurotransmitter to make you feel good, or that enzyme's not going to be pushed enough to shut off your appetite center so you don't stop eating. So this research was all done by Dr. Bruce Ames. So it says, it also seems plausible that for each example of a genetic disease or a polymorphism, and I'm going to go through the definition of that, clearly involving derangement of metabolism, multiple forms of the disease exist that reflect slight increases in the enzyme, but are not commonly thought of as genetic diseases. That's why when somebody comes into the office and they have a particular condition that they've been diagnosed by their medical doctor, but they come in and say, well, is your diagnosis right? Sometimes that diagnosis is not correct because they're believing that they're in full-fledged, let's say, diabetes, okay? But if they're in full-fledged diabetes and use something as high as a Cataplex GTF to pull them and get their enzymes moving, you might say, hey, they weren't determined to be diabetic. They can change that and express that enzyme differently through nutrition to pull them out of diabetes. Okay? Does that make sense? So there's variation. So when we say, oh, somebody's got Parkinson's disease, well, what is Parkinson's disease? You know, you got the pill rolling, you got the walking, you got a certain posturing, you got the tremors, you got the cognitive, you can't remember. There's a bunch of, it all has to do with dopamine up in the brain. And I'm going to talk about that. But you can have a 25-year-old come in that has pre-Parkinson's symptoms that obviously could have a nutritional deficiency. That doesn't necessarily mean they have Parkinson's disease. Now, I put this table up here because this is an example of all genetic problems, where they're located, and the disease or the condition. Now, none of us are going to have this in here. None of us are going to have this right here. But some of us will have variations of some of these diseases that actually have to do with, this is vitamin B6. Okay? Gyrate, part of the brain atrophy, choroid, retina, degrading sight to even blindness. Would vitamin B6 be helpful in somebody that's having vision problems, but yet they don't have this full, they might not have that full activity of that enzyme? Okay? Here's your homocysteine, optic lens dislocation, osteoporosis, skeletal abnormality, mental retardation. Vitamin B6 can raise an IQ level. So what's been called a mental retarded case might necessarily raise their IQ level because they need more enzyme being pushed and higher levels of B6. Okay? So I wanted to see it. Here, I put this other one up here for kidney stones, deposits, renal failure. That enzyme's not going to be fully defective, but it might be mildly causing these problems in the kidneys. Polymorphism, it's a gene variant. There's one way to have it, and then there's a variation of that same gene, and it doesn't respond at the same rate as the other gene. So some polymorphisms that are associated with a phenotype, which means how your genes are expressed, not what you're born with, are associated with a phenotype, have been shown to alter cofactor binding and affect a large percent of the population. An example of this would be this enzyme right here, this enzyme, which I don't even know how to pronounce it. You need dietary folate in order for you to push this enzyme, but yet when they tested people in a dementia study, this enzyme was lowered by 53%. So these people needed what? Higher folic acid levels for dementia. So maybe they didn't have dementia, maybe they had a mild folic acid deficiency, they needed to up the dose. Now, what I'm going to be talking about tonight is this particular enzyme. Glutathione S-transferase, or GST, are a family of detoxification enzymes which catalyze or break down the conjugation of a wide variety of inside and outside toxins with glutathione. Glutathione basically is your master antioxidant in your body. Okay, this pathway is your initiator of just about every cancer. Glutathione in itself is basically consists of 3 amino acids. So, and I'm going to go into all that. But for right now, what we got to understand is this enzyme is problematic in the population. So that means if this enzyme has a polymorphism or a variant and can't detoxify quickly, or some of them that can't detoxify just about at all, this enzyme can't take glutathione and attach it to toxins such as petrochemicals, solvents, fungal toxins, alcohol, lipids, antibiotics. These make these water soluble. So these are leaving mostly your kidneys. Your kidneys take care of your water solubility. So this enzyme right here is so important for all these chemicals. So people that like the smell of gasoline, you go up and you like the smell of gasoline, or you're very sensitive to the perfume section or the cologne section, or you're very hypersensitive to vitamins or minerals or herbs, your body's just in a hypersensitive state. Okay? This is this pathway that is not working for you. It's that simple. Antibiotics, we know what antibiotics are. Everybody's taking antibiotics. Now, this GST or glutathione transferase defect happens in 50% of whites in the United States, about 30% of African Americans, and 15% of Asians inherit a polymorphism or a change in this enzyme. That's what you're born with. That's why I should have put that article up that I used probably about 4 years ago that said that 75% of all cancers are environmental. How could 75% be all environmental? Well, it's obvious. It's this pathway right here because our population is weak at detoxifying this pathway. Now, people who this is what kind of what you come up against with medical diet. They believe that detoxification is a bunch of nonsense. Well, this proves that this is actually does something in your body, and this is a reason to detoxify. Most people don't know why they're detoxifying. They're just used to, hey, I clean my deck, I clean my sink, I clean the toilet. Maybe we need to clean ourselves, stuff like that. But this gives a reason why you need to do it, and this very reason of people that are exposed to these chemicals these days have a decreased detoxification capacity because of their genotype, because of what they're born with. People who lack GST don't experience problems unless they encounter a specific chemical that needs to be quenched. Has anybody in here never encountered specific chemicals? In here? This is how nonsensical. I took this out of a quote, out of what some doctor said. Now, this is too long to read, but basically it says you got a defect in how your body produces glutathione. Glutathione is your master oxidizer of most of your chemicals, all those things like toxins, chemicals. This problem, what's happening right now is there's a polyform. Your body can't make glutathione as efficiently as it's supposed to. So basically, the enzyme can't bind to the glutathione, and the glutathione is not in a high enough capacity to take care of the job. So you got two problems now. Given the hypothesis involvement of oxidative stress and association with the glutathione S transferase deficiency is such far-ranging disease processes as aging, macular degeneration, COPD or chronic obstructive pulmonary disease, HIV infection, neurodegenerative disorders, and cancer. Further analysis of this gene is warranted, and it's very prevalent in the population. This one, if you're using chemotherapy for your cancer, you might get another cancer. That's why these people get cancers. For tamoxifen, they're using an anti-estrogen medication, and they end up getting not cancer from blocking the estrogen, but they get cancer on the other side of the breast. They get the other breast. 4 to 5, they know it. If you're on tamoxifen for more than 4 to 5 years, you are going to get cancer. So now they've come out with a whole different other remedy of medications to take care of that. But leukemia is huge. I don't know how many people, leukemia is showing up. I have 3 patients, that came in with it. I've seen a lot of patients with it. Dr. Tent's seen a lot of patients with it. I mean, this is a problem with this defect in this pathway, and it's a serious situation. And I'm going to tell you how to fix it. Gene defect may raise passive smoke asthma risk. All these people, I played hockey my whole life, and when you go out on that ice and you're skating around, and you got the cool air and you're just skating around, and everything's going fine, all of a sudden you could smell that one person smoking in the whole rink. I could always step on the ice and smell somebody. They must have opened the door to the concession area, or somebody smoking at the far end. We've all experienced this, but it's particularly in my life. It just tightens up your lungs. You're like, you got to get this guy out of here. He can't be smoking, around the players. And there's some players that can smoke and play hockey. It's weird. But this is because of this pathway. But they're finding right now that this pathway right here, people that have asthma, they have this problem. One of a number of genes proposed to involve detoxification of environmental tobacco. Okay, this is secondhand smoke. So if you're that sensitive to secondhand smoke, you definitely have a problem with the pathway. I've probably been looking for this article for, 3 years now. We see a lot of attention deficit disorder, hyperactivity, a lot of learning disabilities, a lot of autism stuff. All that has to do with the brain, okay? The most important neurotransmitter for your child to have up in his brain at the right level is dopamine before he walks in that classroom to sit down and study or take a test or learn. All our Ritalins, Adderalls, Concertas, all those medications are dopamine. They're getting your dopamine levels up. The better your dopamine levels, the more your kid can focus and concentrate. Okay? The kids that have a genetic defect in this pathway have low dopamine levels because their immune system's using the dopamine to detoxify and to help this pathway correctly. So basically, you're taking something over here that's used for your focus, your concentration, and you say, hey, I need it over here. We got to use it for this because, your body's just trying to be in a survival mechanism. It's going to grab whatever it needs. So these kids that have this is saying that we demonstrated overexpression of these dopamine neuron degeneration. This is all from glutathione S transferase problem up in the brain. The master antioxidant up in the brain is glutathione levels. And glutathione levels is your strongest antioxidant to your brain, your liver, your prostate. There's tissues across the body where it's higher and lower, but those are your main ones. So this is saying that if these observations suggest that a variety of compounds known to induce or take this glutathione and express it more may provide a promising therapeutic strategy for Parkinson's disease. I'm going to offer a strategy at the end of the lecture that works on this particular enzyme and raises glutathione levels so that you can adequately run your detoxification pathway. Here's a doctor, MD from Johns Hopkins University, William Nelson. What he found was that this particular pathway, 88 of 91 men had a defect because their liver couldn't detoxify harmful chemicals, had cancer in the prostate. I haven't heard any articles come out in the news. The only thing I hear is men getting reamed and rods being stuck in and radiated. I haven't heard any of this information. This is almost near 100%. You think they're going to tell you that in public, that this is a major factor and that you have a defect in your prostate and we can't do anything about it? It says a possible prostate cancer prevention may be a therapeutic augmentation by using inducers or glutathione and something that's going to move this prostate enzyme. Yeah, look at how old that is. This is in the National Academy of Sciences of the United States. 89 of 91, it doesn't get any better than that. I mean, there might be a flaw, it might be 87. But you can't tilt that any way except one way. Here's glutathione and lymphocyte activation. All the people that are showing up with these autoimmune diseases. Last lecture I talked about the hepatitis B shot that caused all kinds of problems in Europe. I forget what the condition's called now, but in Europe they stopped doing the hepatitis B shot at a certain age because it was just causing too many problems up in the brain. Demyelination. And when you're dealing with this pathway, all these pathways have to do with neurodegeneration or nerve degeneration. These are the sensory nerves in your brain that make your brain run. But what they're saying is that aging and autoimmune disease, glutathione, if it's not there, your immune system either overacts or underacts. Either way, it ain't going to act correctly. Here's variations in detoxification genes linked to Lou Gehrig's disease. I put this one up here because this doesn't have to do with that particular enzyme that I just talked about, that GST, but this enzyme is a little bit different. This is the enzyme that breaks down your cholesterol. You know, your cholesterol drugs, your Lipitor, Mevacor, Zocor. This is why this is so dangerous to do those medications for so long of a period, because this same pathway, organophosphates, insecticides, paraffin from your mosquitoes, diazine, chlorpyrifenes, nerve gas agents. If you're on a cholesterol medication and you're a golfer and you have a little defect in this pathway, you're in trouble. You're in trouble. That was July 6, 2006. And these are the three enzymes they're finding that aren't working correctly, but yet they're stuffing in your cholesterol-lowering medications and using them, and you could very well be at risk. Or you know what? It might not be Lou Gehrig's disease, but it might be maybe a little palsy. Maybe just some palsy instead of Lou Gehrig's disease. Because it wasn't extreme, but it's still enough to take out your autonomic nervous system. Here's depletion of reduced glutathione enhances motor neuron degeneration. So that's very, very important, because if you have any motor neuron degeneration, like I said, the palsies or the Lou Gehrig's disease or the multiple sclerosing sometimes can affect how the muscle strength is involved. Anything that has to do with the motor neuron, that's exactly what's involved. And the higher the glutathione levels are, the better. It said, at least to motor neuron degeneration. This was an ALS. Demonstrate decreased GSH promotes multiple bad pathways contributing to nerve degeneration. Here's one in MS. People wonder, how do I get MS? Well, there's a lot of reasons why you get MS. Probably the first reason is you don't have the capacity to take care of something that you were situationally involved in. It could have been a flu vaccine and you have this little defect that caused your MS because of the chemicals that are in those vaccines. Or it could have been your, it could have been your fertilizer you put on your lawn and you're not equipped with that enzyme. So this says, our results suggest that long-term prognosis in MS is influenced by a genetically determined ability to remove the toxic products of oxidative stress. They're not going to like that because that medication is very expensive. That could be anywhere from, oh geez, it's probably going to be about $3,200, $3,500. So, but that came out of the American Academy of Neurology. This also says glutathione reduces toxicity and improves the quality of women diagnosed with ovarian cancer, treated with cisplatin. Actually, they use cisplatin. They use the glutathione. If you're a ovarian cancer patient and you're sensitive, or you decide that you've been talked into chemotherapy, you probably want to get your glutathione level up. If you haven't been talked into chemotherapy, there's probably other things you can do. But keeping your glutathione levels up stopped most of the side effects from the cisplatin or the chemotherapy. And this says the results demonstrate that adding GSA to this ovarian cancer allows more cycles of cisplatin treatment to be administered because less toxicity is observed, and quality of life is improved. So if you get talked into chemo and it suits you for some reason, then there's a benefit that you can get at the end of the lecture. If you don't, you can still get the benefit and it probably will work just as good. The neuroprotective effects of reduced glutathione is in advanced gastric cancer. Basically, they're saying that if you don't have your glutathione and the enzyme doesn't work, your chances are nil. Here's another one. You know, it's not easy. You got to take a piece of information from here, a piece of information from here. I'm putting this all together so you understand how much is involved. But this is not, I don't order this off the internet or from a book, okay? I look at my own research and I put everything together and find out, is there a common theme through all this, and that's what I present to you. Okay, I do not order lectures from other doctors or other books. I use resource materials and journals and all that, but I do not have my lectures prefabricated. Basically, it says from southern Italy, they found that these people had a high excessive rate of cancer with this specific enzyme, and I keep on giving you this principle and this point, but I want to do it. Keep it going. This is, you can't produce synthetase deficiency. You can't produce your glutathione at a fast enough or accelerated enough rate. So you don't even have enough in your body if you even encounter this. And on top of that, you might not have the right mechanism to detoxify this out of your system. And we use a lot, we have a lot of detoxification programs. This one, this is not to replace what we've already used. We use SP Complete and Vitanox to do detoxification. We use the SP Complete program with 3 or 4 other products for detoxification at different levels. This one is the most aggressive for this specific pathway. The other ones are general. I thought this was kind of neat. Did an immunization trigger your child's autism? Autism coach parent poll. Most kids that come in, it was after the shots. There's very few that come in and say, well, I had it before the shots. Okay? So there's if you want to do some more research, autism coach, but 70% said, hey, there's something going on. There's something fishy with the shots. Here's a study that just lined up. It was in the it was on the Reuters, Washington, April 23rd. It said pesticides can cause Parkinson's disease is stronger than it has ever been after a meeting of experts. I think I'm an expert. Who have put together links in animals, people, and scientists say. One study shows that farm workers who used the common weed killer, paraquat, had 2 or 3 times the normal risk of Parkinson's. This protein has been linked, which is alpha, I don't even know how to pronounce that. A third piece of puzzle shows that this buildup of protein kills the same brain cells affected in Parkinson's. those are your dopamine neurons that produce your dopamine, okay? And those dopamine neurons are protected by your enzyme that I've been talking about and shouting about, GST. Dr. William Langston founded a nonprofit. Good, it's a nonprofit. All these pieces really look like they're coming together now. Now, in your glutathione conjugation pathway, this is how conjugation just means that your body takes something that's toxic and makes it less toxic so your body can excrete it correctly, so it doesn't stay in the body. Pesticides and herbicides are probably the biggest and foremost problem we're having. Like I mentioned to a couple people, only 1% of all the pesticides that we use in our foods actually rid the pests. That's what they found. They're up to 1 billion, the amount on pesticides that you're using. 1 billion. Herbicides, plastics, everything's plastic. Everything's plastic. Plastic bags, Ziploc bags, rubber tires. There's all types of plastic. The main ingredient that's in your plastics that makes your plastics flexible are your phthalates. Phthalates are the nasty, nasty ones that your body always wants to detoxify. And we're always in contact with that. Your styrofoams, your Ziploc bags. Your baby bottles.
DIDP,
Yep. So it's just pronounced as your phthalates. But those are, and the thing is, that's just not a regular plastic. That's added to plastic to help its flexibility, but there's no way of holding that phthalate in that plastic, so it's excreted all the time. It's not something that's bound and held in there. It's always being exposed and being leaked, whether it's in the environment, your body, in your hand, your mouth, whatever it may be. Car exhaust and cigarette smoke is pretty obvious out there. I mean, they got smog advisories in Los Angeles and Mexico City. I mean, it's a cloud. New York City. I mean, the air's getting bad. Alcohol is a big one. I mean, alcohol is a huge one. Alcohol is obviously turned into formaldehyde in your body, so you better have enough of this pathway in order for you, because you will embalm yourself early. You will. Alcohol, but there are some benefits to alcohol, but the offset of the formaldehyde, I mean, kind of squelches that. Bacterial and fungal toxins. Bacteria and fungal, the biggest fungal toxins we're exposed to today are antibiotics. If you've taken an antibiotic, you've taken a fungal toxin. Okay? Fungal toxins are nasty stuff. They cause cancer in themselves. They cause neurological diseases. They cause allergies. I mean, that's basically, if you pick up that book, The Yeast Connection, that most people know about, or if you don't know about it, pick up the book. It's the name of it. It's The Yeast Connection. This is talking about all fungal yeast, mildews, molds, candida. All that stuff is covered in this pathway right here. Okay? Bacteria. I mean, our gut's got more bacteria than all our cells in our body. So if you've been on antibiotics, just the fact of your own gut bacteria turning over waste is enough to pollute you in itself. I mean, there's so much bacteria waste, you'd be surprised. Pharmaceuticals, good golly, you just open up a page in a magazine, there's pharmaceuticals everywhere. Okay, pharmaceuticals, you don't imagine the metabolic byproducts of pharmaceuticals. They might have done what they're supposed to do, but man, the after effects are so beyond what you can even imagine. And toxic metals. Toxic metals, I talked about, if you want to know how to aggressively get rid of toxic metals, that's my chelation therapy. Okay, I did a lecture on that. It's on video, you can pick it up at the office, but glutathione helps with toxic metals, but it doesn't help as much as that other program that I put together. So it helps a little bit. All right, let's keep on going. This is the product that I want to talk about. The name of the product is Zenaplex. Obviously, they got a patent on this product. I picked it up I didn't have a pharmaceutical salesman come in and talk to me, and I didn't have somebody call me on the phone and say, hey, I picked this product up. Are you interested in carrying in your office? Most of the products that I find, if not all of them, are found myself to suit my needs, because I see, Dr. Tennant and I see so many patients and so many different problems that we try to bring other things in to complement, and that's basically what my job is. Zenaplex may be just what you need if you've ever taken, used, or eaten birth controls, antibiotics. Painkillers are huge. Tylenol, acetaminophen. Who hasn't been on an acetaminophen? Acetaminophen lowers your glutathione levels very aggressively. Hairspray. All women are just full of this stuff when they go to their beauty salon and their hair products and laundry detergents and cleaning the house. I mean, household cleaning items, alcoholic beverages, food containing preservatives. I don't need to go through the preservatives. We all know there's more than we can count. I mean, there's millions. There's only about 6% that have actually been studied on the body for all the preservatives. So, fruits and vegetables, pesticides, or if you live in polluted cities. Now, this is the actual function of the glutathione. It protects cells against oxidation injury, participates in the synthesis of proteins. What protein are we looking at? Dopamine. Dopamine, serotonin, norepinephrine, epinephrine. Basically, when this pathway goes bad, you get affected by dopamine. Dopamine helps you with focus, concentration. It helps raise your blood pressure, allergies. Norepinephrine, epinephrine, everybody heard of our catecholamines or our stress hormones? All those get used up very quickly when this system isn't working. So yeah, stress does cause things. But is it the foremost cause? No. It's the genetics that are involved, and it's the glutathione levels that aren't at adequate levels for various reasons. Initiation, progression of white blood cells, essential to the immune system. It's critical for natural killer cell function. Prevents, treats liver and blood disorders. That's your leukemias. That's your hepatitis. That's your cirrhosis of the liver. That's any inflammation that's causing you to have a fatty liver because your immune system's overreactive. And then you got your drugs, your metals to detoxify, aging, radiation, chemotherapy, accelerates the respiration in your brain. That's what you want. You want excess acceleration. And your cigarette and smoke and alcohol. Now, Zenaplex is made up of 200 milligrams of glutathione and 200 milligrams of organic coffee. Okay? The glutathione, we already know, is important, but the problem is getting enough glutathione so that if you do have an extenuating circumstance like MS, cancer, ADD, ADHD, Parkinson's disease, Alzheimer's, I mean, you just go down the list, any type of immune dysfunction, there's a problem. Your body, glutathione is made up of these three amino acids. The problem is, when you take this orally, your body looks at these amino acids and it digests them. You can't get the level high enough to take enough. There are certain foods that have glutathione levels, high glutathione, like asparagus is your best glutathione food. But it's not going to get it to the level in the extreme circumstance that you need it at. So absorption of glutathione orally is nil. It's very difficult, takes a long period of time, and an aggressive situation, you need to get it up to take care of it. And then glutathione doesn't work alone. It's not enough to get your glutathione levels up, but you also have to get that enzyme that I talked about, GST, up high enough, because Without that enzyme, you won't take the glutathione and stick it to funguses, bacteria, solvents, chemicals. Those two things need to be together. Okay? So the glutathione in the product is basically glutathione 200 milligrams. And what I want to talk about now is the organic coffee that raises the enzyme GST. Okay? So it doesn't work alone. Now, they've been using coffee, alternative people have been using coffee enemas for the longest time. Coffee enemas just haven't been just recently introduced, I mean, in the 1900s. I mean, they were used by, the Greeks, the Assyrians. I mean, it goes back to a long, Egyptians used to use coffee enemas to detoxify themselves. But when you get into the coffee enema, you got to understand, how is it working? Now, coffee enemas were first introduced into the Merck manual in 1917. This is 1899. They were aware of it, but in 1917, the coffee enema was put into the Merck manual, which is basically the Bible, the medical Bible, okay, for treatments. Then they took it out in 1977 because they ran out of space. There was other things they needed in there, and they just dropped it. Doesn't mean it's less important. It just means that it was there. It can be referenced, and it was a treatment that was used for various situations. They basically, the coffee enema was used in 1970 at the first time it was put in there, but around World War I, when for surgeons, they used to, before you go into surgery, they got to evacuate your bowels. So they would use an enema. You use a water enema or different types of enemas to evacuate the bowels. Well, a nurse happened to use coffee, and the patient's progress got better. They were more energetic. They were relaxed. That's kind of like a paradox. You can have more energy, but you can be relaxed. We're either one way or the other. But they noticed that there was a huge advantage in wound healing, in regeneration, and detoxification. And one of the first pioneers of cancer therapy, which was Max Gerson, used it as one of his main staples in his programs to help detoxify the body, because as I just showed you, that enzyme right there, if it doesn't work correctly, your initiation for cancer is going to happen. Okay? So coffee enema is not removed from the just because of the space. Here's an excerpt from the Merck Manual, 10th edition. It says, for medicated, 6 to 8 ounces of coffee, or how about the 1 ounce whiskey? I don't recommend that, but added to 6 ounces would, given their stimulating effect, other medicines should be diluted to 2 to 4 ounces. Now, when you do coffee taken when you go to Starbucks is a stimulant. When you take it orally, it stimulates you. It gives you energy. It kind of makes you wired, makes you excessively rowdy, whatever it may do. But it puts your nerves on edge, okay? When you take coffee in a suppository or in an enema rectally, it relaxes the body, okay? And it speeds up that enzyme that I talked about by 700%, okay? And they have animal studies to prove that the coffee, when taken rectally, like they used to use in surgery, actually increases biliary secretion. Your body makes more bile. It thins the bile better, and it gets rid of the bile because of the fact that it's acting on that enzyme, okay? So basically, Zenoplex supports the glutathione detoxification antioxidant system, and rectal administration of coffee. The coffee enema has been shown to increase glutathione S transferase 700%. Coffee has its own detoxification advantages of dilating the blood vessels and the bile duct to further increase the rate of toxins released. Okay, so this is a great complement. You get the enzyme spinning as high as you can. You get the glutathione so that enzyme can latch on to the toxin, and then you can carry it out. That's the process of detoxification. One process. There's other ones in the body, but this is the main one that's showing that there's a lot of defects in. Here's the implications of use. Any neurological disease. Here's your ADD, MS, Parkinson's, any immune dysfunction, chronic infections, autoimmune diseases, cancer. And I say allergies because there's so many people that have allergies that have this dysfunction in this enzyme. I put greater than 3 to 5. I mean, most people are sensitive to something, okay? But having more than 3 to 5, I mean, is like saying I'm going to live in a bubble and, nothing can fix me and my situation is so bad. This is why I brought this product into the office. So those are your main ones, and those all have to do with either the enzyme, the glutathione, or both not stealing dopamine from your brain and other processes instead of using it for your brain, but using it in your immune system instead. And here's the Xenoplex. See if I got anything else here. Now, does anybody have any questions? Questions? Yeah.
How do you determine the infection pathways?
Is that?
You said there are infection pathways.
Yeah, usually you get, without going through all the excessive testing and all that, usually you can tell by symptoms. Anything neurological, that pathway has a problem. So neurological meaning Parkinson's, Alzheimer's, ADD, ADHD. So most of the time it's just by a symptom process. But there are tests you can get out there that you can have run to check that specific pathway. And most of the time they do check it with acetaminophen and certain, they can even check it with coffee to see how your body processes it and how your body excretes. So, but in our office, we keep it simple. If just from my experience of reading the research and knowing the disease condition, a lot of times I could send for a hair analysis. We could do other tests, blood work. Sometimes with these conditions, you'll have high white blood cells in certain areas, or real low blood cells, or low platelet counts. I mean, we can use a bunch of tools, but it's basically just at my discretion what I think. What tool? Question?
Glutathione, and you can deliver to your body through IV.
Yes.
You're doing that?
That's what they use for mushroom poisoning.
Yeah, you're doing that in your office?
No.
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 You know anybody who's doing that?
No, I'm using this to replace that.
Now,
So you can do it in you can do the privacy of your own home,
Okay.
and you don't have to worry about the expense, and it doesn't have to be administered by a doctor.
Okay, now, since it has to go through your digestive system.
This doesn't go through your digestive system
Okay.
because you're using a suppository. You don't have acids and digestive enzymes, so you don't have to worry about that as far as absorption. Yep.
I had an ionic spa treatment for detoxification. Are you familiar with that, where they put a sea salt, put a bath, and
Yeah, I'm familiar. I don't want to go into that right now. I could talk to you after about that. I don't want to go into that now. Yeah.
Say glutathione is poorly absorbed orally.
Mm-hmm. At low levels.
You're talking about just dumping in the stomach, the digestive system. I can see that. But what about sublingual, where you're holding them out and going into the blood vessels and the mucous membrane there?
Mm-hmm.
Would that be as effective? It should be as effective as suppositories.
Hmm? Yeah. If there's a product out there that can do
If you held it in the
that.
mouth and did sublingual as opposed to dumping in the stomach orally.
Yeah. Well, how are you going to complement the coffee? They put the two together so that they're synergistic. How are you going to get the GST up? It's not enough to get the glutathione if you can't stimulate the enzyme to use the glutathione. So that's why they put the two products together. So it's not enough to take it just orally, glutathione. You still have to get the enzyme activity up. So that's why the product is so unique. Yes.
For you?
About
Okay, let me-
prescription medicines where there's an insert in there about side effects.
Mm-hmm.
And when she talks to her doctor about it, it can cause blindness or many different things, vomiting, what have you. And then she'll talk to the doctor, well, I don't want to take this medication because the side effects. The doctor just boo-hoos it and says, oh, well, that's not going to happen. That's
Yeah, I can't-
But, they just say, oh,
I can't change everybody's mind. I mean, everybody mean, I have knowledge, background knowledge on it, and most people that are telling people not to do something, a lot of times they don't have background knowledge on why you're doing that. So they're focusing on what they think is best for them. I'm doing what I think is best for my patient. Yep.
You use the term the polymorphism.
Yes.
Not sure what that means. And the second thing is green tea that you buy at the grocery store. Is that helpful at all, or is it?
Absolutely.
Is it?
Yeah.
Okay.
Green tea's helpful in the store, but you know, it helps. They've said it helps with stomach cancer, digestion. They use this particular one. You'd have to drink a lot of green tea. So there's an advantage to using a supplement so that you can raise that level. There's no way you're going to drink that much tea. So it's a variant. It's in greater than 1% of the population. It's a variant of the enzyme. So the enzyme doesn't work correctly. So you probably need something more, or you need a little excess to offset that. Okay. And there's various, with genetics, there's various, I mean, this is only one system. There's 5 other systems in the body. I picked this one because this is very unique, and this is what I see was the most prevalent out of all the problems. Questions? Any more questions? Yes?
I just want to know, is this a protocol you would follow once a year, 3 times a year?
It depends on your situation. Usually, I would recommend the SP Complete. So if somebody just comes in, they want a detox, I wouldn't recommend this. I would recommend this more in extreme cases. If you have a condition and it needs to be get accelerated a little bit quicker, and the treatment needs to be a little bit, quicker, then that's what I would do.
Okay, thank you.
Yeah.
How do you deal with cancer patients as part of your client?
I don't deal with cancer patients. I give them things to support their immune system or support their body that might be defective, and then I allow their body to take care of itself.
So do you have any success stories about helping to stop the cancer in your own practice?
I don't stop cancer. I give them the supplements and let their body stop the cancer. Question?
Talking about medications can lead into something. Since I'm taking phenobarbital, could that lead into something, major problems?
No.
Okay.
No.
That's okay, thank you.
Any more questions?
She just wants to know, can you microwave, if I'm gonna make tea, should I microwave the water, or is it better for me to boil my water?
It's better to boil.
Because it tastes different if you microwave the water.
Yeah. Any other questions? Yes.
What about vitamin and mineral deficiency? How do you determine that?
We do muscle testing in the office. We use contact reflex analysis, and then we do muscle testing, and then we use their history, their symptom picture. We have a symptom survey in the office that we use. So a lot of times it's just basically on head knowledge. You know, what conditions involved, what's your family history, just as much information as any other doctor would use.
Did you talk about what that 10 suppositories, the 10, they want to know what 10 means.
10 are 10 separate suppositories.
1 0.
Yep.
Which company is making that?
I think it's Vivagen. Yeah, it's just 10. Most people, most people can see a difference with the Zenaplex. If you have Parkinson's, you'll see an immediate difference after your first suppository, that quick. Immediate.
Would you do all 10?
Yeah, if you got Parkinson's, you got to keep up. Because your body, remember, your body gets so behind because it's got so many other things it's trying to do to detoxify. I mean, our healing happens in stages. So, just getting the enzyme going and getting that out, that's not the process. I mean, if you got deterioration of the myelin sheath in your nerve, that's a process that takes time too. So it's just not like, do one thing and that's it. So it's a process, but I would agree with anybody that your biggest result you'll see in at least 3 to 6 months. I don't know when my next lecture is, but hopefully you enjoyed this. What time is this hockey game on? Other than that, we're all set. Thanks for coming. I appreciate it.